Dr. Mishra, Dr. Chauhan, distinguished colleagues from India and a lot of developing countries of the world. I think when I came into this hall, two things I noticed. That a lot of friends from abroad were enjoying Indian food, and my nameplate carried, I read it as chef guest. So I thought I was probably hosting in to friends and colleagues from a greater part of the world. Having said that, I think when I first heard of what some friends and colleagues have shared, I would wish to narrate two incidents which just struck my mind. It is about 28 years back when my mother had a cardiac problem, and we were told that she would need an intervention, and the only option we had was to fly her to Texas, Houston, to the famous Dr. Denton Cooley for treatment. 3 decades later, it's very heartening to see India emerge as a global hub, not just for healthcare, but for healthcare education too. These 2.5 decades of progress of India, it's not just that we feel very proud of the fact that India as a country has progressed, but we feel proud of the fact that a developing country, we all used to be called, I think most of us present here, used to be called underdeveloped world about a decade back, till someone in the United Nations decided that that's probably not too pleasant a terminology to use, so we are now called the developing world. So here's a country of the developing world, a country which belongs to a group of all of you, leading the healthcare revolution and healthcare education revolution of the world. My heartiest congratulations to Dr. Mishra, his team, and a whole lot of other physicians in India and abroad who have taken upon themselves the pleasant though tough task of educating our colleagues. I am also a remember of a second incident when I was called in for a similar function nearly about a decade back in Singapore, which was organized by a company which globally makes laparoscopic equipment. And I was called in for a similar function where we had about 50 doctors who had undergone training on models sponsored by this company in Singapore. 10 years later, it's a pleasure to actually stand here on our own soil and see how we have transformed great Indian surgeons into great Indian teachers. It's also important to understand the significance of continuing medical education and professional upgradation. As Dr. Chauhan just mentioned, I am currently in the process of setting up with a US-aided group a chain of hospitals, all in Tier 2 and Tier 3 cities in India, and some in the underdeveloped parts of the world. We have some friends from Nigeria. We are setting up a medical school and hospital with the University of Cape Coast in Ghana. We have a lady with her child from Haridwar, and we are setting up a hospital in Haridwar. So we've just acquired the Swami Bhumanand Netra Chikitsalaya, and we're setting it up into a multi-speciality, super speciality hospital, and that's what we are aiming to do. But as we do all that, I remember when for the first time as the head of the Indian Medical Association, I proposed that continuing medical education should become mandatory for all of us. What I learned when I did medicine 30 years back probably would have changed twice or thrice over. And what is going to be the significance of people and professionals upgrading their skills? When I proposed that for the first time, let me be very honest to share with all of you, I'm sure maybe you get similar reactions in your countries, there was a lot of opposition from the profession. They said, you are wanting to plunge us into some sort of a retest every 5 years? You're going to plunge us into some sort of completing a mandatory CME hours? Where is the infrastructure which exists in the country where you can do this? And the like. There was a very similar reaction when we proposed the PNDT Act, when we proposed that female feticide is a shame on the nation. So there were a whole lot of ultrasonologists, with no offense meant to my colleagues, who came up and said, oh, you're going to take away our bread and butter. But I think what is true in India, I've had the pleasant task of visiting most of the countries of the world. All of you here, I visited your countries. I think the doctor-patient relationship has touched its lowest ebb. The confidence, 30, 40 years back, we were the friend, philosopher, guide, and the God for a lot of our patients. We are slowly losing that confidence in our patients. In India, we commonly say that now every time a doctor sees a patient walking into his chamber, you view him as a potential litigant, as someone who will go to a consumer forum court and file a suit against you. I think if we were to analyze and get into the depth of the root cause of this, then it is, in addition to a whole lot of other factors, that we have not volunteered to upgrade our professional skills voluntarily. There is the developed world, there are countries like the US and the European Union, countries which have made it mandatory for you to complete a particular number of CME hours. But I think it's countries like ours, it's developing countries to which most of you belong, where we need to initiate voluntarily, move forward and say that we need more such upgradations of our skills. What happens to a surgeon who did his MS surgery when the laparoscope was not born? What happens to all of us who were probably using chloramphenicol for enteric fever when we were taught our medicine? Who is going to teach me what I'm going to prescribe today? So I think if one was to totally analyze the whole gambit in which we are, continuing medical education and continuous upgradation of your professional skills is something which may not be a part of the Hippocratic Oath, but is definitely something which is absolutely mandatory in the fast-changing arena that we are living in. My congratulations to Dr. Mishra, his team. My congratulations to all of you who have, without any statutory mandates, volunteered to come in and upgrade your skills. And I think it's going to help you professionally, help you probably economically and monetarily, and above all, help humanity. That we have experienced surgeons who, when they were probably trained as surgeons in medical schools, did not have access to laparoscopes and laparoscopic surgeries. And today, they put in their few decades of experience and their few weeks of training here to finally go in and do for their patients what probably would be warranted, required, demanded in a consumer activist arena today when a patient walks in your chamber with an internet downloaded treatment modality. And unless we know what we are doing or what we can do, it becomes extremely difficult. So my congratulations once again. I don't know why Dr. Chauhan mentioned that he wanted me to touch on bioterrorism. What is the relationship of bioterrorism with laparoscopy? I don't know. But since he mentioned about that, I would briefly touch on that. You see, post the 9/11 episode in New York, we had a spate of these bioterrorism threats which were looming large, especially on the US. I was one of the members of the APEX committee which was summoned in by the WHO and the WMA to look at what these envelopes containing some white powders were being circulated in the US, and people were very afraid of what all this is. And that's where bioterrorism actually became known to the whole world. It has existed in medical literature and right since World War I. But what I was amazed at when I moved there, that the knowledge on bioterrorism to some of our friends in the developed world was very, very meager. Again, no offense meant, but I'm a very frank and blunt talker. So, and I mentioned that to Dr. Chauhan, that you'll have to bear with me, because I don't mince around with my words. So in a WHO, WMA apex body of bioterrorism, we had a gentleman, a colleague from the US, who comes up and says that he was looking at Mycobacterium tuberculosis being used for bioterrorism. And he put in a whole lot of theory of how it could spread tuberculosis in the world. So I politely asked him, the very famous man, I wouldn't want to name him, I have a lot of regard for him, he's a global figure in respiratory medicine. So I just asked him, I said, so how many cases of pulmonary tuberculosis have you seen in your life? So he said, oh, I have seen a whole lot of them. I said, how many? He says, in my career spanning about 3 decades, I have seen 36 cases of pulmonary tuberculosis. So I told him, I said, I see that every day. So where I used to practice, where I started my practice in a rural outskirt of Delhi about 30 years back, we had stone crushers. And we used to have pneumoconiosis and superadded pulmonary cocks on that. So I think at this pleasant ceremony of you're being conferred your fellowships, let's not get upset with bioterrorism. Let's forget about it. I don't think the threat looms large. Enjoy your evening. Practice what you've learned. I'm sure Dr. Mishra and his team would be too glad to provide you any post curriculum guidance if you would require. And I think unitedly all of us as messengers of that part of the medical community which has volunteered to take up continuing upgradation of our skills, we could contribute to a much, much positive, a much more healthier future. And quoting from the father of nation of India, Mahatma Gandhi, I think I would love to say that the future, ladies and gentlemen, begins from today evening. Thank you very much.